Welcome to another episode of Health Talk. The topic of the day is, each COVID-19 reinfection increases health risks and death. Is fully vaccinated, in terms of COVID protection, considered bulletproof health-wide? The short answer is, no. The risk remains, regardless if people are fully vaccinated. Here's why. Stay tuned to find out the most efficient way to stay protected and healthy. COVID-19 infection is not a joke to play at all, in particular, in the context of reinfection. Public should avoid getting reinfected, as COVID-19 reinfection is not completely benign, in terms of health risks and death. COVID-19 reinfection is not uncommon nowadays, and it's explainable medically. Sadly, no matter how efficient the given COVID-19 vaccines in the first place, human immunity and defensibility to COVID-19 wean off over time. More importantly, the SARS coronavirus 2, the virus that causes COVID-19, possesses natural ability to mutate genetically. The mutated viruses survive to reproduce, and the good mutation in terms of genes get passed on to their offspring in a process so-called natural selection in evolution. One may be infected earlier with the Delta strain, and subsequently exposed to Omicron, or its subvariant, BA.5. The mutated variants, in theory, are better at evading vaccine protection, until an updated vaccines are available. Reinfection was rare during Delta variant wave, but it becomes worrisome and common after the arrival of Omicron wave. A recent large national database study of COVID-19 reinfection on veterans at Washington University implied that first infection may weaken organ functions and make humans more vulnerable to health risks when they get a second or a third infection. Although the exact biological mechanism is poorly understood, the subsequent infections, compared to a first, are linked to a way higher death rate, from any cause, including heart and lung adverse outcomes. In other words, the fully vaccinated people, who survive the first COVID-19 strike, their health status deems deteriorating over time following the second, or third COVID-19 infection. The extra health risks grow larger with each subsequent infection, including risk of long COVID syndrome, with reduced quality of life and death. As the veterans tend to be older with pre-existing health risks, some experts criticize that this study may not be generalized to everyone, therefore, it may not represent the general population. Even with the very first COVID-19 infection, the medically vulnerable groups are at higher risk of adverse health outcomes, including death. Although this clinic research has yet fully validated, and many confounding variables are at play, the preliminary results infer that reinfection contributes to additional health risks, and they should be avoided at all cost. Until then, the best practice for you and for the general public, be it healthy or vulnerable group, is to avoid getting infected by appropriate and regular mask use. People may argue, the face masks are used, yet COVID-19 infection remains inevitable. The bottom line is, using face mask inappropriately and irregularly pretty much mean no use, putting one at risk of infection. Also, be sure to get your vaccines and your boosters, and wear a mask appropriately anytime if possible, in particular, a crowded place whereby a safe distance practice is practically impossible. Prevention is always better than cure. Be safe, rather than sorry for delayed invention. You never know, COVID-19 viruses may stay for decades, or even longer.